Good morning, I'm Dr. Darlena McHenry from St. Carrie's Classroom, and I'm here in Acela, and I'm interviewing the director of the Acela Hospital. Would you introduce yourself to our viewers?
Okay, thank you very much for coming, and I want to say welcome to Acela School of Health Science and Hospital. My name is Dr. Taspaijita. I am working as Associate Dean for Academic and Student Affairs, plus the coordinator of Department of Internal Medicine of Acela School of Health Science and Hospital. Currently, I am in my office, so this is all about me.
Tell me about Acela Hospital and what services you provide.
Acela Hospital was established 14 years back. It was training nurses at the beginning and giving service to the community, around 2 million at the beginning. But now we have a medical school, and we have regular medical students around 439. The medical school was started 4 years back. Before that, it is only training nurses. And currently we are giving service to around 3.4 million people which are in this area, in this surrounding in Arsi and the Bale area. And the school is a new school. Our students are now at the C2. The maximum is the fourth year, the medical students, and we don't have other regular students. Previously, we trained nurses. Because of the change from the policies from the government, currently we stopped training nurses since 4 years. So currently we are only training medical students from first year to fourth year.
Okay. And I understand that you do some work with fistula. Can you tell us about that?
Yeah, we have a fistula center, which is around 4 or 5 years back it was started, and currently it is giving service by community outreach. They will go out and they will look for these matters, and then they will bring them to the hospital, and they will give service. They will have operation, they will have psychotherapy, and all services will be provided in this hospital with partnerships. There are partners to support us in this area, and so with those partners, these mothers who are really terrible, they will come to this hospital and have an operation, and it brought a dramatic change in the society. It is a very good service that we have in fistula area.
Okay. For those American viewers who are interested in being a partner, can you tell us about that process?
Okay. Our university, including Adama Science and Technology University, currently led by the Korean president, is always open for to have a relationship with external partners. Because you know that at the very beginning, as I told you, that this is a new and a beginner hospital, and it's a beginner as a college, of medical science. So especially on the community service area, providing quality service. Because to provide quality service, you need quality medical doctors. To have that, we have to have a training. You know that it is maybe short-term training, long-term training, and especially around the fistula that I've already mentioned. So any partners who want to work with us, we really welcome everybody who want to work with Acela School of Health Science, and we are very happy if partners comes and wants to work with us.
Okay. And tell me a little bit about your public health. You do outreach. You have students that go out into the community.
Yes. So our as I told you that our final year medical students are now the C2 or clinical 2 students, or 4th year medical students will go out after 1 month for community health attachment. We call it a community health attachment. So this student will treat minor diseases, infectious diseases. They will work under supervision, and the supervisors will be sent with them to the surrounding community, and then they will establish a center in that surrounding community, and then they will provide service. We know that at the health center level, we call that the Ethiopian health system is, it will start from health post, which is a very small, and that give service around to 25,000 people, and then you will go to the health center. The health center will provide service to around 50,000 people. So our students will be deployed to the health centers. They will try to treat very minor infectious diseases under supervision with their instructors. So that deployment will be started after 2 weeks. very soon we will start that deployment.
Okay.
And especially we need partners on that area, because that community service, the government budget cannot be that much enough to give community service to the society.
Yes.
So at large we need that student will engage also in the research. They will engage in the research. This is their first encounter to understand what community research is. They will develop a paper, and then they will go collect the data and process it and produce a little bit research on community disease, and then they will do something called the community diagnosis. They will diagnose the community at large. What is the commonest disease in that community, in that surrounding that they will be deployed? So they will diagnose that community, and then they will come up with some mechanism to intervene with that common disease in that community that they will be deployed in the future. So that is a good thing that we are trying to do in the future. Within 2 weeks, the student will be deployed after 2 weeks.
That sounds great.
Yeah.
Is there anything else you would like to share with our viewers in terms of how they can contribute or help this effort?
Yes. There are ways, because currently we are, before everybody understand, including our government, that our problem is infectious disease. If you go to sub-Saharan countries, including all African countries, what comes first is that infectious disease are the top killers. That was the thinking that was there before 20-30 years back. But currently, as the economy is emerging and everything is coming out, the chronic disease prevalence is increasing. Especially now, I came to Asala Hospital 2 years back.
Okay.
When I came to this hospital, the number of diabetic patients that we had was 340 and something. But currently we have 790 registered diabetic patients.
It's doubled in what amount of time?
It's just 2 years. It's not more than 2 years that the number is reaching to 719 patients are registered now as a diabetic, including type 1 diabetes and type 2 diabetes. So that we have to intervene this chronic disease, as well as that we had the huge burden of HIV and other infectious diseases. So this chronic disease is also emerging, and so we need a support in this area, especially that in our diabetic clinic we don't have separated diabetic clinic. Patients cannot buy insulin because it is expensive. Some partners are trying to help us, but it is not enough. That comparing with the number of patients that we have.
Yes.
So in that area, I think that it's good if we work with some partners. And the other thing is in the community service area, that to provide quality service to the community, and then to have that good stay, and then to help the community in some way, we need some partners to work together. Otherwise, the university cannot afford that all community service that we provide. And the other is the fistula area. The fistula area, that there are thousands of mothers who have fistula because of this early marriage.
Yes.
Currently there is that the movement to change the attitude of the society towards the early marriage, that to avoid it. The teaching is there, but still there are mothers who have this fistula problem, and we have one gynecologist and obstetrician who is doing this surgery, who's giving this surgery to the patients. But we want to improve the quality there, because the room is very narrow and everything. So the quality and the service in number and the quality has to increase.
Yes.
Both we want to increase, and it's good if people want to work with us on that area. The other is on the staff upgrading. That staff, we have medical doctors, we have nurses, we have other instructors in basic science like pathology, physiology, biochemistry, and whatsoever. So that to have a good education system, you have to have well-educated individuals.
Yes.
That we have to upgrade our staffs. So in that area also short-term trainings. For instance, if I give you an example, we have 3 internists, that are working in Department of Internal Medicine.
Yes.
But that none of our internists can do echocardiography. We have cardiac patients,
right.
That with different kinds of cardiac problem.
Yes.
But none of them can
specialize in cardiac medicine.
In cardiac medicine, yeah.
Okay.
Especially doing echocardiography, interpreting the problem that they have, and then to treat them on the objective based medicine, that to practice something which is an objective based kind of medicine. So that's our big problem, especially in the area of internal medicine.
Well, thank you for your time. I appreciate Dr. Safa. We're going to take a look around your clinic, and hopefully people will show some interest, and we'll see what we can do for you.
Okay, thank you so much.
You're welcome.
Thank you.